and welcome to Home Solutions. My name is Terry. We are pleased you've chosen us to help you meet your therapy goals in the comfort of your home. For a complete overview of our services and what to expect, please watch our Home Solutions introduction video. Your doctor has ordered medication that we deliver to you along with the necessary supplies. We also coordinate a nurse that will arrange a time to visit based on your dose time. This video will show you how easy and safe the steps are for administering your ordered therapy. When your nurse arrives, she or he will teach you in depth everything needed to safely and effectively complete your therapy plan. So let's begin. Home Solutions will usually deliver your medication and supplies on a weekly basis, but this is based on the stability of the medication once we mix it. Some therapies are delivered monthly. Your Home Solutions care team will let you know the plan for your specific therapy and coordinate delivery times with you. The medication will be labeled refrigerate if it requires such. If you are getting multiple medications or therapies, please check each one to see which does or does not require refrigeration. The pre-filled flush syringes and other supplies to care for your catheter do not need to be refrigerated. We supply everything you need to take care of your IV catheter and infuse your medication. Many of the supplies provided are meant for the nurse to use. Each time you get a new shipment, you will want to use the older medication first, but never infuse medication that is expired. If there is a concern about your medication or the packaging or containers appear damaged in any way, call Home Solutions immediately. Do not use. Check your medication label for your name, the correct medication and dose, as well as the expiration date. Saline is sodium chloride or salt water, which is fluid that is in our bodies naturally. And heparin is an anticoagulant or keeps the blood from clotting in your catheter. It will be flushed into your line as the last step in your infusion process to keep your line patent or open and ready for use for the next scheduled dose. Depending on your catheter type, you will use either SASH or SAS. Your nurse will help you understand which you should follow, and the pharmacy will provide the heparin if it's ordered. SASH simply stands for saline, administer medication, saline, and heparin. SASH is the acronym to help you remember the order in which you will use each. Home Solutions protocol for all catheters except a portacath is to flush twice a day, per lumen, and a lumen is a single pathway. Some catheters have multiple fluid paths. Each fluid path or lumen must be flushed twice daily. If heparin is ordered, it will be 10 units per ml heparin in the blue cap, or 100 unit per ml heparin in the yellow cap. A nurse will review what protocol is specific to your catheter. Your dosing schedule is determined by several factors. How many times a day your physician ordered the medication, when you received the last scheduled dose prior to coming home, and what time your next dose is due. At each dose time, you have 1 hour before or after that dose time to infuse your medication and still maintain the levels in your bloodstream to be successful on your therapy. So if your dose is due at 8 a.m., you can infuse any time between 7 a.m. and 9 a.m. Your specific schedule will be reviewed by your nurse. Usually the prearranged schedule for the delivery and a nurse to arrive is planned around your first scheduled home dose. Let's set up your supplies for your infusion. Parenteral nutrition bypasses normal digestion of the stomach and the bowel by being infused directly into your bloodstream through your intravenous catheter in your vein. The parenteral nutrition formula is mixed based on your needs, with consideration for your lab results, such as sodium and potassium, your nutrition needs, and what goals you and your physician have determined for you. Some vitamins and other medications will be added to the bag the day you infuse it. Our clinical dietitians and pharmacists are experienced in managing parenteral nutrition and help monitor your progress and needs to report back to your physician. Home Solutions will mix your parenteral nutrition bag according to your doctor's orders in a sterile environment. The size or volume of each bag of nutrition is determined by the amount of ingredients you require. Each nutrition bag will have your name, nutrients that your doctor ordered, rate to be infused, and an expiration date. If it does not, stop and call the pharmacy staff who are available 24/7. Now that you understand how your therapy is dispensed, let's begin by reviewing the steps necessary to successfully complete your infusion in the comfort of your home. Pulled one parenteral nutrition bag out of the refrigerator minimally 1 hour before your scheduled infusion time in order for the bag to reach room temperature. Each bag is stable at room temperature for 24 hours, so it can be taken out and prepared at any point during the day, as long as it is not at room temperature longer than 24 hours total, including the infusion time. If you have forgotten this step, do not attempt to immerse the bag in hot water or place it in the microwave, for this will compromise the integrity of the nutrition. Knead the formula with your hands a few times and look for any discoloration or streaks. If the formula is white, the formula is clear, check for cloudiness or particles. If any of those are present, do not infuse the bag and alert the pharmacy. Retrieve another bag and perform the same assessment. The issues can be related to the stability of the formula after mixing it in the pharmacy. Although these issues are extremely rare, we want to teach you to look for them. Once you have looked the bag over and verified that the information is correct, your name and the bag is not expired, you are ready to gather the rest of your supplies. Here is what you will need. 1 package of high volume tubing, alcohol swabs, 1 for every time you will be connecting something to your catheter, 2 normal saline syringes, and 1 heparin if heparin is ordered, multivitamins, 1 syringe and needle, and an alcohol pad. Each additional additives like folic acid or insulin, alcohol pad for each of those. You'll need the battery pack, CAD prism pump with a 9-volt battery. Remember, the battery pack will not work if the 9-volt battery is not in the pump. A sharps container to dispose of the additive syringes that have a needle. And you'll need a coin. This is used when putting the tubing on the pump to turn the lock. Now that we have all of our supplies, we are ready to add any additional medications or vitamins to the bag. First, I want to explain the reason we teach you to add certain medications to the bag. Once added to the formula, certain medications are only stable for 24 hours. Some medications will be pre-drawn up for you in the pharmacy, while others need to be drawn up the same day. So let's begin. Remove the multivitamin vial lid and wipe vigorously with an alcohol pad. Using another alcohol pad, wipe the injection port of the parenteral nutrition bag as well. Using the syringe and the needle provided, remove the cap from the needle, careful not to stick yourself. Push the needle directly into the center of the vial top, invert, and draw the fluid out, pulling the needle back as you do, so to keep the needle below the fluid line. After you draw up the multivitamin, inject it into the Parenteral Nutrition bag injection port. You need to keep the needle straight. If you angle it to the side, you could accidentally puncture the plastic and cause a leak, and you would not want to use that bag. You want to discard the syringe with the needle in the sharps container we provide, then gently rotate or knead the bag to mix the multivitamin up. The same procedure to add additional medications will need to be followed for each additive. Some additives, again, are pre-filled in syringes for you. Add the 9-volt battery to the battery compartment of the CAD. This battery must be in the pump and the battery pack used because of the high volume being infused. This will avoid you getting a low battery alarm during the infusion and causing an interruption of therapy. The battery pack will not work if the 9-volt battery is not in. Now let's attach the tubing to the bag. Inspect the packaging to make sure there isn't any damage. It should be high volume tubing. Open package of tubing and remove the blue clip from cassette. This is the hard plastic piece. Open clamp on Parenteral Nutrition tubing. You're about to remove a tab, and remember, anything under a cap or cover should not be touched or allowed to come in contact with anything. Remove the rubber tab from the Parenteral Nutrition bag and cap from tubing spike. Then you insert the spike into the bag. Once the tubing is connected to the bag, attach the Parenteral Nutrition cassette to the bottom of the CAD pump. Then pressing the cassette down using one hand to support the pump upright and the other using a coin to turn the lock. The pump will then say prime tubing Y or N. You want to press Y for yes. Priming the tubing simply means you are filling it up with the fluid from the bag and removing the air at the same time. The pump will say disconnect tubing from patient. This is just an alert to make sure that you don't have it hooked up to the catheter yet. Open and close clamps hold Y to prime. So you hold Y button down until it drips out the end of the tubing. Then stop pressing the Y. You now have the pump ready and prepared Parenteral Nutrition bag attached and ready to infuse when you're ready to get started. Lay out your syringes and Parenteral Nutrition CAD in SASH or SAS order with alcohol swabs in between to make it easier to remember which steps comes next. After you have laid out your steps, take your first alcohol swab and scrub the IV catheter injection end cap well. 20 vigorous scrubs is minimally recommended. Your IV catheter injection end cap has a rubber-like end and is a one-way valve. The valve prevents air from going in or your blood from coming out. There are no needles in this process, and all connections attach with ease using a push and twist lure lock system like motion. Prepare the first saline syringe for injection by releasing the air out of the top of the syringe. Remember that once you take the cap off the syringe, it is sterile under there, so don't place the cap down on a dirty surface and put it back on the syringe, and don't touch the end of the syringe. Take the first saline syringe and push, then twist it into the end of your IV catheter that you just cleaned. If there is a clamp on your catheter or extension set, you will have to unclamp it in order to get the saline to flush through. Using the push and pause method, and after all the saline is flushed through, untwist the saline syringe from the end cap. Now, if you have the type of catheter that does not require an extension set, the end cap can be accidentally removed. So make sure you are holding the end cap securely as you twist the syringe. Our extension sets have the end cap locked on, so this cannot be a concern if you are using an extension set. And using the same scrubbing method, Take your next alcohol swab and repeat the cleansing process of the end cap. Take the end of your parenteral nutrition bag tubing, remove the plastic cap or piece from the end. Again, it is sterile under the cap, so make sure you don't touch anything before you attach it to the injection end cap. You want to push, then twist it into the cap exactly the way you pushed and twisted in this saline syringe. In order to infuse the nutrients from the nutrition bag, you will need to unclamp the white clamp located in about the middle of the tubing. We provide a backpack that is specifically made for the CAD and large bags like Parenteral Nutrition. It allows you to be mobile and you can see the pump screen through the side window. Let me show you how to put the pump and bag in the backpack. When your Parenteral Nutrition pre-programmed infusion volume is reached, the pump will alert you. The bag will appear flat and will be almost empty. The pharmacy mixes a certain amount of extra that will still be in the bag. It's usually 50 to 100 cc's or mLs. You are ready to disconnect. Anytime the pump beeps, you need to read the screen to see why it's beeping. It might be an alarm for another reason, such as low battery. When the infusion is complete, press the Start/Stop button. The pump will say, "Stop the pump," press Y. Pump will say, "Stopped." Clamp the parenteral nutrition tubing and disconnect it from the end of your IV catheter. Be careful to not disconnect the end cap. Use an alcohol swab before attaching the remaining saline, followed by heparin if the heparin is ordered. Once you have successfully flushed your line as ordered, the last step is to make sure to clamp your IV catheter if it has a clamp on it. Remove battery pack from the pump and plug into wall charger, making sure you see the light on the charger. Remove the old parenteral nutrition bag from pump along with the tubing and discard. The flush syringes and parenteral nutrition bag with tubing can be discarded in the regular trash. Adhering to the infusion schedule keeps you on track to reach your nutrition goals. While you are on parenteral nutrition, we need you to weigh and record it daily. It is important you alert us if you gain or lose 5 pounds or more within the same week. We are monitoring your fluid retention and loss closely, and these 5 pounds tell us what adjustments we need to make and or if a nurse needs to be sent out sooner than the normal schedule to do an assessment. A couple of the main side effects to monitor for are related to blood sugars and infections. Signs of low or high blood sugar. These symptoms can mean other things as well, but when you start or stop your parenteral nutrition, especially without the taper or while you are off, we want you and your caregiver to monitor for these symptoms. If your blood sugar is low, you could experience dizziness or shakiness, anxiety, confusion, and difficulty doing routine tasks, blurred or double vision, sweating. Blood sugar being too high can cause increased thirst, blurred vision, fatigue, and headache. Your nurse will review what you need to watch for and who to call based on your individual therapy. When we provide parenteral nutrition, we must have lab work weekly and in some circumstances more often. If you miss giving your parenteral nutrition infusion, please let our Home Solutions Care Team know as soon as possible. If your levels are not where we expect them to be, we do not want to adjust the formula if they are off because of you missed one or more infusions. We would evaluate how close to lab draw time it is and discuss when we could draw them to receive an accurate account of your body and how it is adjusting to the formula we have you on. Our certified nutrition support dietitians and pharmacists work closely with your physician team to make appropriate adjustments weekly or more often if needed. Your home nurse draws them from either your catheter or your arm. Several factors determine where we draw from, and this will be determined by your care team and discussed with you. The pharmacy team and the nurse will schedule the day and time with you and plan it so your infusion is not still going when they arrive for that visit. Anything that does not have a needle, body fluids, drainage, or hazardous medication can be thrown away in the regular trash. Place the empty syringes in the trash. Your nurse will review this with you. We provide a red sharps disposal for situations that do require needles, such as drawing lab work. Keep this out of the reach of children, so choosing a place to keep your supplies is very important. We will exchange the sharps container when it is 3/4 full. So please let your care team know so your next delivery can include the new one and take away the old one. A member of the Home Solutions Care Team will contact you weekly or monthly, depending on your therapy, to discuss your supplies, gather some additional information helpful to the clinical team, and arrange your next delivery. If you have added any new by mouth or other types of medications, including herbal, it is very important that you let us know. If you have a PICC line, use the white protective sleeve included in your supplies. This can help secure the catheter that is outside of your body and an extension tubing. Regardless of your catheter type, it is important the dressing remains clean and dry. Looking at your catheter site daily to see if any complications are present is important as well. Some of the complications could be things such as redness or tenderness at the insertion site, and the insertion site is where it goes into your body. Any drainage at the IV site, pain or swelling at the site, or in the arm or shoulder it is in. Inability for you to flush the line and never force it, or if your IV catheter dressing is coming off or gets wet. Make sure you have our number in a convenient location, as well as a nursing agency's number if it isn't Home Solutions nurse caring for you. Whoever is providing your nursing service is the agency you need to call for any catheter-related concerns or questions. If you have any questions or concerns, you may contact the Home Solutions branch servicing you 24 hours a day, 7 days per week. The number will be on the labels and is provided for you in your patient packet of information, including a magnet for your refrigerator. Adhering to the plan of care discussed by your nurse will help you reach your therapy goals. If you miss a dose, please let your Home Solutions Care Team know as soon as possible. If your physician ordered lab work related to the therapy we are supplying, your home nurse draws them from either your catheter or your arm. Several factors determine where we draw from, and this will be determined by your care team and discussed with you. If the medication you are on routinely requires lab work prior to a certain dose, the nurse will schedule this day and time with you. If you are on an IV antibiotic it is important that you do not dose prior to them arriving to draw the labs. And it is imperative, if you have missed a dose since the last pre-dose lab draw, that you inform the nurse and pharmacy. This can cause your medication level to appear too low, leading to an increased dose recommendation, when in fact, it should not be adjusted. Your nurse will discuss any other considerations needed for your specific therapy and lab draw needs. Your nurse might be one of Home Solutions or one from a nursing agency from your community. This is usually determined by your insurance, your choice, needs other than IV such as wound care, or someone your physician or hospital transition of care team designated. If it is not a Home Solutions nurse seeing you, please make sure you have both our numbers and theirs where you can easily reference. We coordinate with and assist our community agencies when they are involved. Medication compliance is an area your entire clinical team is concerned with. Our pharmacists and patient service representatives need to know any changes to your medications. This includes all medications, over-the-counter, herbal remedies as well. Your nurse will review side effects of your medication that you should alert your physician to 24/7. You have a pharmacist available that can answer questions about your medication and work with your physician care team to resolve any concerns. Step-by-step instructions for performing the steps discussed are included in the packet of paperwork Home Solutions provides. We take pride in providing exceptional care with respect and consideration for your needs. If at any time your patient experience is less than desired, please let us know. We value your feedback and are committed to making process improvement an integral part of our organization. We at Home Solutions welcome you to our family and thank you for choosing us as part of your care team.